Public health officials are warning about the rising number of measles cases across the country. Two more cases reported in Quebec this week, bringing the provincial total to 12. Joining me now is Dr. Earl Rubin, the director of the Infectious Diseases Division at the Montreal Children's Hospital. Doctor, thank you very much for joining us today.
Good morning.
We are up to 12 across the country now, two more in Quebec. Is that a good sign or is it concerning still?
It's still a concern because of how infectious measles is, but what is a little bit reassuring is that the numbers have not grown significantly over the past week, or at least as far as I know.
Now, could we still see a sudden jump? Could the incubation period mean there could be some delays in this?
Absolutely. So the incubation period for measles is quite long. It ranges between 7 and 21 days, but the overwhelming majority are around the 2-week mark. So if there were exposures within the last 10 days, still in the next 4 days, let's say, there is still the chance that we'll have secondary cases, and people are infectious for 4 days before the onset of the rash. So if we have a secondary case, we're going to have to do the contact tracing of all the people they were in contact with.
Now, does this show that that our immunization levels are pretty good? I know we've had concerns about them, but is this indicating that maybe they are working still?
So the belief is that to get herd immunity, to really curtail an outbreak, we need an immunization uptake of about 95%. Overall, it's about 80%, but there's certain pockets or communities where it's less, and that's really what fuels some of our concern.
Now, that's to that you've announced there's an immunization campaign going on in schools. Are we getting to the people that need to be convinced that this is a good thing?
Well, hopefully public health with their messages will reach different people, but there is a lot of vaccine hesitancy out there for a multitude of reasons. And as spring break, at least here in Quebec, finishes, there will be a campaign to make sure that the schools check the immunization status of the children, and the ministry is setting up pop-up vaccination clinics so that people can be caught up.
Any concerns about shortages of the vaccine? I got a note from my doctor's office about the MMR, measles, mumps, rubella, and it was only for children 1 and under who had never been vaccinated. Nobody else can get it right now. Any concerns about shortages of the measles vaccine?
So I think that the issue isn't so much the shortage. The government is well aware and is getting adequate stock to catch people up. It's when there is an exposure and we have to give immune globulin to prevent it and not the vaccine, that there is a significant shortage for infants under the age of 1.
Now, do we need to make it mandatory? I mean, people can still opt out for their children getting vaccines for measles. Should it be mandatory?
So the policies vary from province to province. In Quebec, it is not mandatory, and there is no plan to make it mandatory, but there is the plan to try and encourage people, to educate people. There are the vaccine hesitant parents who are concerned, and with adequate education and information and addressing their concerns, we may be able to convince them. And then there's the anti-vaxxers that no matter what you do, you cannot convince them. So at the present time, at least in Quebec, it is not mandatory, but from each province to province, it varies.
Okay. Dr. Rubin, thank you very much for joining us this morning.
My pleasure.
Dr. Earl Rubin is the director of the Infectious Diseases Division at the Montreal Children's Hospital.